Di sini adalah yang merangkum dari service launching dan maintenance and operation dan total care support. Dia jadi jalur tengah gitu kan. Dan baru keseluruhannya adalah total care support. Ini memang memerlukan waktu yang tidak sedikit dan kepedulian dari pemerintah yang betul-betul concern terhadap kesehatan masyarakat. Intinya di sini bagaimana kita semua itu mereduce biaya-biaya yang harus dikeluarkan oleh masyarakat untuk menjadikan semuanya itu menjadi sehat, lebih baik. Demikian, silakan SB, the floor is yours. Please continue.
Please excuse that I cannot speak Bahasa Indonesia, so I must, explain in English. And selamat pagi. This is all I know for now, but selamat siang. Well, it takes time to learn language, so soon I'll learn more. Today, what I'm going to talk about is mobile health. It's a real case, introduction in Korea. Although this is quite a little bit immature still in Korea, but it takes a lot of booms and interest from many big hospitals these days. And although I'm from one of the first telecommunication company in Korea, but these days I'm busier than ever because of this stuff. Because a lot of hospitals just call me and wants to do some project with us. So this is what I'm going to say. Okay, I'm going to talk about our company and also our company's mission about the connected health, and also two case studies. One is in Korea, one is in the United States. We also launched a beta service in the United States about wellness service. I'm not sure how many of you know about our company, SK Telecom. Actually, SK Group is the third largest conglomerate groups in Korea, and we are the market share number one mobile carrier in Korea. Over 50.5% of market share in Korea. So recently we focused on the healthcare business after the mobile operation carrier. So what we're now focusing is recently is B2B business. Since maybe all of you know about B2B business, it's more or less helping the industry, business enterprise industry, to increase their productivity. So IPE, Industry Productivity Enhancement, is kind of service name of our company. So the major focus of IPE business healthcare right now. Okay, so some of the business areas we're focusing is IPE, and we're also working with many different industries, cars and education, etc. So IPE means our B2B business service name, and it focuses on helping private and public sectors to increase their productivity. And in Korea, hospitals are the although their medical skills, doctor skills, and medical system is far advanced, but at the same time, hospitals are very in a sense they don't have much budget, and they're not a profit organization, so they cannot make profits. So that means they don't have money to invest for future medical service, improve their medical service, to improve their customer satisfaction. So in a sense, they're imbalance between the reality and the dream. So that's why they're heavily depending on telecommunication company like us to develop a future service. So that is something that we are now working together. So that's why we are focusing on healthcare areas, And we are, since early this year, we have gone through many projects with big hospitals in Korea. Actually, we cannot work with a small hospital right now, but big hospitals, they want us to develop new service, not only including HIS and e-health infrastructure, but also mobile health. That's what I'm going to say today. So, just briefly, SK Telecom, why SK Telecom is in this business? Since our SKT is one of our conglomerates, among our conglomerates, there are many healthcare-related companies, and the number one HIS vendor in Korea is SK subsidiary, and also SK Chemical is producing biochemicals, drugs. So it's kind of ecosystem is well organized in Korea. So, and also since telecommunication company, one good point about telecom companies in this healthcare market is they know how to make some devices. We're also working with some of the world-leading companies to develop the new type of mobile device. For example, blood sugar, glucose meters and active trackers, etc. Also, as I said, we're working closely with the hospitals. So, in that sense, since I'm working with the doctors mostly, I know the trend. I know what they want. I know what they really want in the field. So, we're kind of heavily focused on just making better solutions for them. Okay. Just let me briefly talk about the trend. The biggest trend we're seeing is not only in Korea but also in other countries, even in United States. Since we have branch offices in the United States just for healthcare business, the medical sector and healthcare sector and wellness sector, they are all separated so far, long time, because they don't work each other. Because they can survive without others' help. But the trend is the markets are changing, the technology is changing, and the government policy to reduce healthcare cost is pushing them to get connected. Being connected produces a lot of value for everybody, not only consumers itself, but also hospitals and governments and insurance companies. And the biggest benefit is hospitals as well. If you have any questions, just feel free to let me know. So our vision of the healthcare industry is connected to become the total solution provider and service provider for connected healthcare. So we are heavily investing on the not only HIS but also in e-health platform infrastructure to make them connected, to share the data, not only wire based, but also wireless based. I think in Indonesia, because of the network, situation, and I was surprised to see many people are using BlackBerry and smartphones. I think mobile based application and service is very promising here. So this is the situation in Korea. In early 1990s, Korea, by the full support of Korean government, we started the implement HIS all across Korea Peninsula, and now 99% of all hospitals, including small clinics and apothec and even labs, they're all using digitalized solutions. Maybe 0.1% of some smart clinics in far local area, maybe they can claim their insurance on by paper. But every information, medical information, is all digitalized and accumulated in government agencies data. They're all connecting it. So it took even for us over 20 years to build these infrastructure And also, now it's about time for us to not only to manage it, but also to utilize it to give better values for everybody. So we are now here, even in Korea, hospital, generated information is now beginning to connect it and sharing with the healthcare sectors. And at the same time, big hospitals are preparing for the next future. That is, we call it PHR, personal health records. So it's kind of overlapping situation. We're now here. I think Indonesia might be around here. So maybe you're also in the same track. I do not doubt about this because everybody is gearing, to go to this direction. I've been in the States. I've been in other countries as well. I met a lot of, doctors in Singapore, Thailand. They all agree this is